Hey there, David from Bodyworks here again. Today we are going to work on the hamstrings. Now, a lot of massage therapists, just like the quads, will work very broadly on the posterior leg, thinking that they're getting the hamstrings, but each hamstring is a separate muscle belly. And if we don't distinguish them, there's a danger of jumping from one muscle belly with very deep pressure right over to the next one. And when you immediately jump into any muscle with deep pressure, it will react and jump and tighten. So if you can really learn to think of them as 3 separate muscles and even 4 muscles with the second head of biceps femoris, and really distinguish each in your work, you're going to get way better results. So let's get to it. All right, so now we've got her leg undraped for hamstring work. I've got the drape wrapped around, exposing pretty close up to the gluteal fold. The first thing I like to do is just check overall leg alignment. And if you're looking at the top-down view here, you can see a few things. One, compared to the midline of her body, her femurs do want to sit a little wide, and then her lower legs roll in a little bit. So before I even start working on the muscles themselves, I do want to try to place the leg as close to neutral as it will comfortably rest, right? And this is a little bit more aligned already. There's a little bit of rotation of the foot, but now at least the lower leg and the upper leg are more on a classic plumb line, hip joint, knee joint, ankle joint in a straight line. And the rotation of the two is roughly equal. Now, a lot of people will just go into hamstrings and just plow through the entire back of the leg, but the truth is the hamstrings themselves largely sit in the center third of the posterior leg. The lateral third is really vastus lateralis, the quad. The inner is the adductor magnus, the adductor. So the hamstrings themselves do come down and attach here, but they come up right up to there and really get pretty narrow. So when you're thinking about hamstrings, I actually find a tighter tool such as 3 fingers, a thumb. You certainly can use an elbow, but you want to be very precise about it. The other thing to think about is if I'm deeply in the belly of one muscle, like the long head of biceps femoris, and I accidentally jump to the belly of membranosus or semitendinosus, it's going to react pretty poorly to having sudden deep pressure applied to it. So you really want to think about this and try to be as precise as you can be. So I like to draw them one at a time and think about semitendinosus, which kind of starts here at the Pizanserine. And I'm going to come straight up here using 3 fingers. And I'm going to feel and contact it. And then I'm just allowing it to melt under my fingers. And I'm going to work nice and slow so that I know for sure I'm staying in the same muscle belly. I'm not jumping from one to the other. And then, of course, as you get up closer and closer to the upper attachment on the ischial tuberosity, you're going to have a harder time distinguishing which one you're on, and they do start to glue together. And it starts to get a little bit more sensitive up there. And then I can go all the way up. You won't see it under the drape, but my finger can contact the ischial tuberosity from here safely and in a way that the client doesn't find invasive. Next, I'm going to just find the center. So membranosus also attaches down here to the head of the tibia, the medial condyle. But I want to avoid the major nerve cluster right in the back of the knee, so I'm going to come up a little higher, find the middle muscle belly, and then sink in. And I'm just going to slide slowly up through. And I did actually at the very end just jump off accidentally from one to the other because they get very, very narrow. And then I like to work biceps femoris from the hip down for a few reasons. One, most people have some lateral rotation of the lower leg, and that long head pulling on the head of the fibula can pull that out. And so I want to draw this down so that it starts to lengthen towards the center. You could do it the other way, and that's fine as well. In a lot of ways, direction isn't that meaningful in myofascial work, but there's a suggestion here that the lower leg rotate, and I kind of like making that suggestion to the client's brain. So I've got the contact here, and I'm just gonna slide down, and I'm hoping to see this heel start rotating that way, which it is. I can also contact with soft fist for that. On a scale of 1 to 10, Mary, how intense is that?
About an 8.
Good to know. I would say 8 is by far the limit, and had I asked that earlier, might have softened out to make it more of a 6 or 7. Okay, so that gets the major 3 long heads of the hamstrings. The biceps femoris, has 2 heads. Biceps, sep in Latin means head, bi, two heads. And we never think about the second head as much as I would think about it. So the second head also attaches to the head of the fibula here, but instead of going all the way up to the ischial tuberosity, it actually goes up to the middle of the femur. And if you think about this from here to here contracting, what it's going to do is pull that head of the fibula that way and bring the lower leg into lateral rotation. And so with a lot of people, you'll see this overlateral rotation of the lower leg compared to the upper leg. And the easiest correction for that is to release the second head of biceps femoris, which I'm going to do like this. I'm going to bring the leg up. I'm going to find the tendon of the long head, which you can feel right here. I'm going to find the IT band, which you can feel very big right here. And if you go between those and then under the long head, come up to about here, you're going to be on the second head. And this will feel like I'm dragging a scalpel down her leg in some cases. So you want to be really precise, and you don't actually want to use tons and tons of pressure. This can feel pretty weird. How does that feel, Mary?
It felt, it just became a little bit more intense.
Yeah.
About there, yeah.
And hopefully after doing that, I can find her leg more easily resting in what would be neutral compared where the upper and lower parts are rotated properly to each other. Cool. So we showed just a simple myofascial stripping of the hamstrings using 3 fingers. Let's say that somebody really felt like their hamstrings weren't moving at all, and I wanted to get a little bit more pressure. The first thing I can think about doing is making them go slack, right? Because when the foot's totally down, it's mostly stretched out. If I bring the foot up, then I've made some slack in the muscle, I've shortened it, and it should loosen it and make it easier to work on. And then the next thing I can do is come in here with an elbow It's a little harder to landmark, so I would open with the other technique first. But I can contact here. If I want, I can do a little passive movement, pinning and stretching the hamstring under my elbow, and just slowly slide right up the middle towards the ischial tuberosity. This should feel more intense, Mary, correct?
Slightly, yeah.
Slightly. And that's good that she said slightly, because everybody thinks elbow has to be deep, deep, deep pressure. It doesn't have to be. It can be very light. It's just a good way to save your fingers, because hamstrings, you know, if you really try to go deep with your fingers on hamstrings, you'll just beat your hands up. Okay, so that's another technique that can be very helpful. The last one I want to show in prone position is that as the muscles get further and further up, they tend to get stuck to each other and they stop being able to glide off of each other. And so there's a technique separating the tendons that I'm about to show that can help distinguish the muscles from each other. So to do this, I'm going to have her hold her leg up for me. I'm going to come around in front of it. I'm going to hook my thumbs into the tendons of Semitendinosus, membranosus, and Biceps femoris. I'm not going to go down. I'm just going to get on the inside of them and go medial and lateral. So you definitely don't want to be putting downward pressure here. And you want to make sure that your arm is in front of their lower leg, because if I come in from here, she won't be able to do what I ask her next. So I'm going to get out in front. I've got my thumbs in right between these tendons and I'm just pulling them laterally. Okay, so now what I want you to do, Mary, is as I'm in here, I want you to slowly lower your leg for me. Slow, slow, slow. And as she goes slow, I'm gonna slide my fingers up into the bellies of the hamstrings and take a break. Yeah, and that one can feel pretty weird, but we've got some nice movement now between all of the different hamstrings. Cool, let me balance you out. So, today we worked on a bunch of easy to learn techniques for distinguishing and working on each individual head of the biceps femoris and each individual muscle belly of membranosus and semitendinosus, the hamstrings. The hamstrings obviously are integrated into the entire leg and hip and knee and will affect walking, squatting, sitting. So if you would like to learn not just how to release those, but actually think about those in relationship to the entire rest of the hip wheel, and also how the pelvis relates to the spine and the ribs, we offer a great 2-day live course on pelvic realignment that covers all of those, and not just the hamstrings, but how to integrate them into the rest of the musculature. That is offered roughly twice a year at our New York City Midtown classroom. And it's a 2-day course for 12 credits in New York State and any state that takes NCB/TMB credits for continuing education for massage therapy. You can find links in the description below to sign up to that class or any of our other live classes, webinars, or on-demand content. And if you liked today's video, we think you'll like this one too.